Hello, my name is Gregorio Torres. I'm the head of the science department of the World Organization for Animal Health, WOA. I'm a veterinary epidemiologist, and I'm responsible for the rabies portfolio at the WOA. In the previous module, you learned about how to prevent rabies in people. Now, it is my pleasure to guide you through the fourth module of the course, titled Preventing Rabies in Dogs. In this module, you will learn about the importance of mass dog vaccination and why dog schooling is ineffective, what methods are the best to vaccinate dogs, how we can measure progress towards rabies elimination, and what challenge we might find along the way, and why regional coordination is crucial. Approximately 99% of the human cases are transmitted by dogs. Therefore, addressing rabies in dogs is key to preventing rabies in people. To stop rabies transmission between dogs and from dogs to people, we need to vaccinate at least 70% of the dog's population at risk. Dog vaccination is the most cost-effective way to prevent rabies, and you can find more details in Module 7, Rabies as an example of One Health economics. Dog schooling is not an effective way to prevent or eliminate rabies. Dog schooling is usually indiscriminate and ineffective in the long term because the dog's population will eventually bounce back if resources such as food remain available in the environment. It is also counterproductive because vaccinated dogs can get killed in the process, and unvaccinated dogs might grow up in their place. It can be risky when people try to hide and reallocate their dogs to save them. And schooling is often conducted using inhumane methods that negatively impact community support. Mass dog vaccination is a far better option because it prevents rabies in dogs and therefore stops transmission from dogs to people and from dogs to other animal-like livestock. This protects people who might struggle to access to post-exposure prophylaxis and protect the lives of livestock and the livelihood of rural communities that depend on them. Eliminating rabies in dogs is a three-phase process that requires sustained effort over several years. Phase 1, preparation, involves research to understand dogs' ecology and the social dynamic of the rabies transmission, training the workforce, for example, dogs vaccinators, and increasing political and public support for elimination. Although studying the local dogs population is key, dog vaccination should not be delayed and can start immediately and continue in parallel with the ecologic studies. In the second phase, scale up, different methods of vaccination should be tested to find out what works better for the area. This is also the time to make sure that all the necessary logistics and equipment are set up and working well. The third phase, sustainability, assume that the program has found a methodology that is successful, cost-effective, and scalable. This phase aims to achieve 70% dog vaccination coverage and to repeat mad dogs vaccination campaign annually for 5 years to 7 years. This is also when a robust surveillance program becomes critical to determine if the program is successful and when we need to design strategies to prevent rabies from being reintroduced. Based on experience from around the world, the entire process from preparation to eliminating dogs' rabies could take up to 13 years. Sustained political and financial commitment is essential throughout to avoid interruption and delays. There are 6 important steps for a successful mass dogs vaccination effort. First, you need to conduct study to understand the dogs population in the target area, but this should not delay starting a mass dogs vaccination campaign. Second, you need to estimate your target population, so you know how many dogs you need to reach to achieve the target of 70% vaccination coverage. Third, you need to decide on your vaccination method or methods, which might vary depending on your context. Then it is time to start vaccination. Make sure you do not forget puppies. Finally, it's important to evaluate dogs' vaccination coverage to make sure you are successful, and to engage community, to sustain effort, and to make sure dogs vaccination is effective. I will cover each of these steps in more detail next. Around the world, dogs live alongside people in very different ways, but two criteria help us to define dogs population and not what kind of dogs we are dealing with in the area where we are starting our dogs vaccination program. These criteria are dogs ownership and dogs confinement. If we look at dogs ownership, dogs can be owned by a family, owned by a community, such as village or neighborhood, or they can be feral or unowned. If we look at confinement, dogs can be always confined when they live within the fence perimeter of a house and they go out only under strict human supervision. Sometimes confined when they are frequently allowed to roam about unsupervised, and never confined when they are completely free to go wherever they want. Together, these criteria allow us to see what type of dogs mainly contribute to the transmission of rabies. Irrespective of ownership, those that are sometimes or never confined, which we call free roaming dogs, contribute most to the transmission of rabies and therefore should be targeted during mass dogs vaccination campaign. Estimating the dogs population is also important to help understand how many dogs you need to vaccinate to reach the target 70% coverage. To estimate it, you need to identify your target dogs population, which will often consist of mostly free roaming dogs. Then you need to choose a survey method or combination of methods that works best for your dog's population. There are four main types of surveys: mail surveys and phone surveys, where information is provided directly by dog's owner. This only works for family-owned dogs. Door-to-door census are target family-owned dogs and are more resource and time-intensive. Counting methods are the only way to estimate free-roaming dogs, which should be the priority of mass dog vaccination program, but take the most time. When you have selected your survey methods, you can conduct your survey in a specific area. Then you need to estimate the human population in that same area based on official census data or an estimate if this is not available. With this information, you can now calculate the human-dogs ratio and apply the ratio to a representative area to get a sense of how many dogs you are dealing with. Now that you know the type of dogs and how many you wish to target, it's time to decide on your vaccination method. There are four methods available: door-to-door, where a small team of vaccinators visits every house in the area and vaccinate the dogs that live there; central point, where a team of vaccinators goes on an area and sets up vaccination stands in an easily accessible public space, and dog owners bring their dogs in; capture, vaccinate, release, where a team of dogs catcher and vaccinators walk in the area and try to approach dogs that are found in the streets. Some dogs will be approached quite easily. So many be injected while they sleep, and others might require the use of specific nets to catch them. And finally, oral vaccination, where a team of vaccinators walk in the area and offer dogs a plate containing the vaccine that dogs will need to eat. This is the only method that does not require injection. The choice of which is the best method to use depends on many factors, such as your target dog's population, so how many dogs you have, what kind of dogs you have, and how easily it's to access them for injectable vaccination, whether you have injectable or oral vaccines or both, how many vaccinators and dogs catcher you have, your equipment and means of transport, whether you need to organize awareness campaign before or during mass dog vaccination, the level of participation and engagement from the local community, what your financial resources are, and how long you have to complete your campaign. Let's look at oral vaccination more closely, as it is the latest addition to the mass dog vaccination toolbox. You might be not aware of it. Although this method has been used for many decades to eliminate fox rabies in Europe, coyote rabies in the United States, raccoon rabies in Canada, its use in dogs is quite recent. Oral vaccination is crucial to reach dogs that neither dogs catcher nor local people are able to approach and catch. It consists of a bait which contains an attenuated virus vaccine that dogs must ingest. So we need to make sure that the smell and the taste of baits are attractive to the target dog's population. Also, because live viruses pose a potential risks, before their use, oral vaccines must be assessed for safety for dogs, other animals, and people. Oral vaccine might seem more expensive than the injectable ones, but the total cost should be assessed against the alternative of capture vaccinated release method and the long-term advantage of definitely eliminating rabies. Because your target population will often be mixed, a combination of vaccination methods is usually necessary to achieve and eliminate the 17% dogs vaccination threshold. In this slide, you can see that the effectiveness of each of the 4 vaccination strategies varies depending on the dog's population. For example, the door-to-door and central point methods work well for always confined family-owned dogs, but they are not suitable for never confined community-owned dogs. By contrast, the capture vaccinate release method works well, especially for totally free roaming, never confined dogs. Oral vaccination is suitable for most dogs categories. When choosing a strategy, it's important to keep in mind that free roaming dogs, sometimes or never confined, should be the main target of mass dogs vaccination campaign. There are many factors to consider when choosing the vaccination method to use, and no single method is convenient in all respects. The factors we should look at are the cost of the vaccines, all the accessory logistic costs, the need for well-trained workforce, both in terms of vaccinators and dog catchers, the level of difficulty for both vaccinator and dog owner, and the need for high level of awareness in both the community and the large and dog owner. The door-to-door method presents medium challenge, while the central point vaccination method requires great effort from dog owner and high level of community awareness, but it's relatively cheap and easy for vaccinators. The capture vaccinate release method is equally demanding because logistical cost, the need for skilled dogs catcher, and the difficulty for vaccination teams are high. When it comes to oral vaccination, the cost of the baits containing the vaccine is high, but the other aspects are simpler. Regardless of the chosen vaccination methods, puppies should always be included in dogs vaccination campaign for several reasons. First, puppies are common gifts across community, so if infected, they can spread rabies around. Second, children love playing with puppies, which increase the already high risk of contracting rabies in children. Third, puppies lick and nibble to interact with people and other dogs, and this facilitates rabies transmission. Vaccinating young puppies is safe and effective so. Even though the response to vaccination is not as optimal as in adults, it is still important to extend dogs vaccination to puppies in order to sustain dogs vaccination coverage. After vaccination, evaluating dogs vaccination coverage is crucial to measure progress towards elimination. It should be measured as often as possible wherever there is a concern that coverage is not meeting the expected goals. There are 4 ways to estimate the dog's vaccination coverage. The first method is based on the dog's population of the area and target all dogs. It is sustainable when you know your dog's population well, and it's easy and relatively cheap. However, it is an indirect measure and prone to errors. The second method is household surveys, which are suitable only for families-owned dogs in areas where few community dogs. This method validates population-based estimate, but relies on correct reporting of vaccination status by dog owner. The third method is field surveys, which are recommended when you have mostly free roaming dogs in your area, The drawbacks of these methods are its high cost and the fact that you need to visually mark vaccinating dogs. The fourth method is actually a combination of the other methods and is particularly suitable for mixed dogs population. It can provide you with a highly accurate data, but the data collection process can be expensive, and there are very few examples of how to combine data collected using different methods. When dogs are vaccinated, they need to be identified to keep track of where vaccination has occurred. This allows you to exclude the possibility that dogs has rabies if it bites somebody that has been recently vaccinated, and helps to make sure that vaccination campaign target all unvaccinated dogs and dogs that were vaccinated more than 2 years ago. Identification is also necessary for field surveys, which involves counting dogs to determine vaccination coverage. To identify vaccinated dogs, we can apply a collar, use temporary paint, or give owners a vaccination certificate. Community engagement is crucial for mass dog vaccination to succeed and be sustained. To reach high level of community engagement, we need to be aware of sociocultural factors that influence perception of rabies and its elimination. These include religion, and its impact on the way people relate to dogs, the different roles that dogs play within community, for example, as guard dogs or shepherd dogs, what local people mean by dog ownership, for example, in the case of community-owned dogs, how willing people are to handle dogs, for example, to bring them for central point vaccination, the problem of dogs abandonment and its reasons, how the mismanagement of edible waste sustain free-roaming dogs population, local ideas about the effect of vaccination on dogs' health. For example, dogs' owner might be worried vaccination will make their dogs weak, poverty, which might discourage people from caring about dogs' vaccination, major political instability, which makes rabies elimination hard, and people's demand for animal birth control instead of rabies elimination, which I will cover next. Unlike mass dog vaccination, animal birth control, that is sterilizing dogs to reduce their population, is not a priority for rabies elimination. Reducing dogs' density has many benefits, but it is not necessary to eliminate rabies. There are very few examples of successful and sustainable sterilization campaign, and to make an impact, sterilization levels must be at least as high as 60%. Another problem is that surgical sterilization is very expensive and requires consistent infrastructure and a well-trained workforce. Currently, 8 dogs can be vaccinated against rabies at the same cost as one being sterilized. In the future, the development of a low-cost injectable sterilizing agents for female dogs will be a game changer. While animal birth control is not necessary for rabies elimination, other components of dogs population management, such as responsible dog ownership and dog confinement practice, are key. Mass dog vaccination is the core element of the global rabies elimination strategy, locally, nationally, and regionally. As rabies does not recognize political borders, cross-border mass vaccination campaigns are of strategic importance to make sure that countries proceed in a coordinated way towards the goal of achieving zero dogs-mediated human rabies by 2030. Implementing regional strategies also decrease the cost of rabies elimination for all participant countries. In this module, you learn that vaccinating 70% of the dogs population breaks rabies transmission between dogs and from dogs to people. Dog schooling does not eliminate rabies. Rabies elimination is a 10-year-long process that requires sustainable political commitment. Mass dog vaccination must prioritize free-roaming dogs. There is no single vaccination method that works well in all situations. An effective campaign typically requires a combination of methods. Knowing how many and what dogs have been vaccinated is key to measure progress. Community engagement enables mass vaccination program to be sustainable. Regional collaboration for cross-border mass vaccination campaign is crucial. And reducing dogs density via animal birth control is not a priority for rabies elimination. Here are the links to the documents and research paper on the topic covered by these modules. These slides provide you with additional resources, including other open WHO courses that you might be interested in. In the next module of the course, you will focus on awareness and community empowerment. I thank you for your attention.